Hello, Don here. Welcome to Podiatry Practice Mastery, helping you get your practice to the $1,000,000 mark and beyond. I am going to share a little bit about my virtual heel pain webinar lecture 2. So up to this point, I have done 3 of these. One I did a few years ago. I did one online. Actually, it must be number 4. I did one online on webinar. I did another one in person in my Westboro office. Office is a little bit small in terms of like having a big area to do a lecture for. And then I did a couple more online. And I'm trying to figure this out because I think this is, once again, this is something I enjoy doing. I enjoy doing these lectures. It's not hard for me. It takes about an hour. It does take a lot of prep work, and so I'm going to go through a little bit on what we did to prep for this. We had, I think it was 76 registered and 17 showed up, which was a pretty good show-up rate. I'm going to go kind of over what I think worked and what didn't work and what we could do differently. Okay, so what worked, first of all, was we got 17 people, and they came, they participated. They don't participate too much on webinars, I find, so it was really just me talking to these names, which isn't so much fun. What worked is I had my virtual assistants. They did ads for this, so I think we spent $10 a day leading up to it. So for a couple weeks leading up to it, we spent $10 a day with like a heel pain ad, inviting people to come to this webinar. Another good thing I think we did is when they were invited to the webinar in the ad, they didn't have to like sign up for the webinar. They could, but they could also just make an appointment, because many people, they didn't really want the webinar. They just wanted to be come in and seen. And so we did track that as well, just having them kind of come in directly. For the webinar, I used a similar slide deck that I used before. How did I do this slide deck? I did it with like ChatGPT and Canva, and so there's an integration between ChatGPT and Canva where you can kind of say what you want, and it kind of works on these slides. And then I made little tweaks and modifications for the slide deck for the webinar. Once again, if you want that slide deck, you can just shoot me an email, don@podiatrypracticemastery.com. Happy to share that with you. And then you can just look it on my YouTube page. I think it's Dr. Pelto. That's my handle on YouTube. You can see that webinar. And so I did the webinar. Something else that went well, I practiced it before. I know this sounds obvious, but whenever I'm doing a webinar or a lecture, I like to practice it before. But I don't just practice, I record it. So I actually make content as I'm practicing it. Pretty easy way to do that is open up Zoom and just hit the record button, and then you can share your slides and do the presentation. It gets you better at practicing, and it makes it a little bit more real because you're recording it as well. So that's a good way to make content. Then you can repurpose that, put that on YouTube and things like that. Now, some downsides were that when I recorded it, the way Zoom records, it has your little picture in the upper right-hand corner, and it's really hard to cut into shorts, meaning like stuff for social media, because my head was so small. Even though when I presented, it was 50-50 screen, when it records on Zoom, for some reason, it just records that way. And so I struggled a little bit with that. I haven't quite figured out how to fix that, but that was not so good. Another thing that wasn't so good was that, we're spending this money, and I didn't really find direct correlation to patients coming in. Like, patients didn't come in and say, hey, I saw this webinar, that's why I'm here. I know my virtual assistant said they tracked it, but I want patients to come in. So I'm thinking maybe next time we could have an actual offer, like they could print out a coupon or something like that for, I don't know, a free gift or a free bonus or something like that, so I can actually track who comes to see me, or if maybe they even saw some of the other doctors. So that's something that didn't work. Third thing was, I switched from using Calendly for people to sign up to just Kajabi. And I think the switch is Kajabi only does email, and Calendly, which is like just a setting up meeting thing, it also sends emails and it sends text messages. So I think the text message, I had a higher turnout when I used to use Calendly for these things. So I think just the email, people can ignore them. I think text message is a little bit harder to ignore. And so even though, like I said, around 70 people signed up, we spent money on those people. They didn't show up because we didn't have the texting portion. So I'll probably return back to Calendly in the future. And then the next thing would be, I think doing a webinar is good, but I think it would be better to get people butts in the seat at the actual clinic. So I think having people come into the clinic, even though I could only maybe house maybe 20 people, maybe 25 in the clinic, I think that would be more fun to do that from like 6 to 7 on heel pain at the clinic, because I think that way it would be an easier transition. I think I could show shockwave easier. I think I could show ultrasound, actually doing ultrasounds on patients a little bit easier. So those were kind of the pros and cons. My next plan is to do another one. Hopefully I can find a way to do texting as well. I think texting works a little bit better than just the email component of it. The problem is I just downgraded my Calendly because I was trying to reduce amount of expenses. So I may have to figure out another method of doing texting for these webinars. Because I just feel like I was trying to reduce all these subscriptions that I have lately. But that was my idea with this heel pain webinar. I still like the idea of doing this for heel pain and for specific things. I'd like to know your ideas if anyone has done that before. Shoot me an email. I'd love to hear from you. And hopefully this will benefit you and inspire you to consider doing a webinar for your patients. If I was going to start this all over again, all I would do is I would maybe not even do ads right away. I would just send it out to my email list and just say, hey, I'm doing this webinar, and put up some signs in the office and invite every heel pain patient you see that week to that webinar. And that might be a good way of doing that, because then you could get those patients that way. They're already your patients, but you're just going to go in depth in it. I think it'll help with some higher value treatments that you can talk about, such as shockwave, and talk about different case studies. Okay, we'll talk to you guys next time. Have a great day. Bye-bye.